Hey kids. Digital Dad here. In this video I will tell you what does a seizure look like. Seizure signs and symptoms may include temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, cognitive or emotional symptoms, such as fear, anxiety or déjà vu. Typically, it will look like the seizure starts suddenly with the person stopping their activity. You will see staring, loss of facial expression and unresponsiveness. Sometimes eye blinking or upward eye movements are seen. What are the 4 types of seizures? The different types of generalized seizures are absence seizures, formerly known as petit mal, tonic-clonic or convulsive seizures, formerly known as grand mal, atonic seizures, also known as drop attacks, clonic seizures, tonic seizures, myoclonic seizures. What happens to your body during a seizure? During a seizure, many things may happen. Sufferers may lose the ability to swallow, have difficulty speaking, experience twitching or jerking movements in the body, and even experience convulsions. They may lose consciousness, see flashing lights, experience visual hallucinations, and feel out-of-body sensations. What triggers a seizure? Triggers are situations that can bring on a seizure in some people with epilepsy. Some people's seizures are brought on by certain situations. Triggers can differ from person to person, but common triggers include tiredness and lack of sleep, stress, alcohol, and not taking medication. Can you feel a seizure coming on? Some patients may have a feeling of having lived a certain experience in the past, known as déjà vu. Other warning signs preceding seizures include daydreaming, jerking movements of an arm, leg, or body, feeling fuzzy or confused, having periods of forgetfulness, feeling tingling or numbness in a part of the body. Can you fight off a seizure? If so, something called sensory grounding may well allow you to fight off your seizures, or to delay the seizure until you are somewhere safe or more private. Can you talk during a seizure? People who have simple partial seizures do not lose consciousness. However, some people, although fully aware of what's going on, find they can't speak or move until the seizure is over. They remain awake and aware throughout. Sometimes they can talk quite normally to other people during the seizure. Is it okay to sleep after a seizure? Some people recover quickly from a tonic-clonic seizure, but often they will be very tired, want to sleep and may not feel back to normal for several hours or sometimes days. Most people's seizures will stop on their own and the person will not need any medical help. What are the 3 main phases of a seizure? Seizures take on many different forms and have a beginning, prodrome and aura, middle, ictal, and end, post-ictal, stage. These phases are described below. Is a seizure painful? Some children experience pain as part of a simple or complex partial seizure. Ask your child if their seizures are painful. While a child is having a tonic-clonic seizure, they may cry out, fall to the ground and convulse. What to do after someone has a seizure? Keep other people out of the way. Clear hard or sharp objects away from the person. Don't try to hold her down or stop the movements. Place her on her side, to help keep her airway clear. Look at your watch at the start of the seizure, to time its length. Don't put anything in her mouth. If this helps, please write yes in the comments below and leave a like. Love you kids. Thanks for watching.